Hey, it's Dr. Toby here. In this video, I want to answer the question, will surgery solve a pinched nerve in your neck? And it's a very simple question to answer, but I want to share with you some helpful information that will help guide you in your decision-making process on how you actually approach fixing that pinched nerve in your neck, not just from a temporary standpoint, but permanently. So let's jump right into this. So a lot of times when people have a pinched nerve, one of the things that is a challenge for them is they want to know, okay, cool, what is the option that's going to fix this permanently? Because maybe they've tried pain medications or they've tried other different solutions, and maybe even they haven't tried anything because the pain just came on really, really bad and it feels like a pinched nerve. And so they're trying to figure out, what's the option? Am I going to have to get a surgery for this? And the answer is, a surgery may not necessarily fix the problem. Now, let me explain. If you understand the actual root cause of a pinched nerve, then you will understand why most of the time a surgery won't necessarily fix the problem. And the reason why is because surgery is really only addressing the symptoms, not necessarily the root problem. And so let's talk about that for a moment. One of the things that is very basic to understand that causes a pinched nerve is that the nerve is being pinched, which means that there's compression to that nerve by something in the surrounding area. Typically what would happen is that they're going to, if they do a surgery, they're going to maybe remove some of the area that is pinched. Maybe if it's like a joint surface, they may shave it off. They may cause a plate to stabilize that neck in that area. But the whole point is that with the surgery, what they're targeting to solve is the symptom of pain, the pain and the discomfort that you're feeling. But the pain is not the biggest problem. It's only the indicator of the problem. The pain is only letting you know that there's something that's going wrong. And so if we only address the pain, what happens is we're not addressing the actual root problem. So for most people who we've worked with, who I know, some of which we've helped them to prevent getting a surgery. Some people who only saw us after they got a neck surgery, like a fusion or a release of some of the joints or muscles in their neck and things like that, and they got that surgery. A lot of times after the surgery, there's still pain and discomfort. And so what happened, right? Well, what happened is we were targeting the symptom and not giving a actual solution to the root problem, which is creating space that is sustained by the body. And so will the surgery fix the pinched nerve? Not necessarily. It may, but not necessarily, because again, if our goal is to create space, what we want to be able to do is do that in a way where our body is actually able to reverse whatever has caused the compression of that space. Now, you can reverse that manually through a surgical procedure, but it doesn't guarantee that your body is not going to still revert back into that same position, or other nerves are not going to become intensified in terms of their pain or their discomfort after the surgery. So one of the things that we explain to our patients is the simple fact that you can actually, first of all, figure out and detect what's causing the actual pain or the nerve to be pinched. Why is the nerve being pinched? Is it a muscle that's really tight that's causing the nerve to feel that restriction? Is it a joint that's causing that nerve to be pinched, maybe like arthritis or degenerative disc disease, where you're having bulging discs from your neck pinching the nerve or causing that compression, right? Is it the nerve itself, that the nerve is just tight and really tense and it's caused inflammation and things like that? What is the actual issue? Once you've diagnosed what's actually going on, then you can actually determine, what should I do about it? What are the areas that I need to really adjust? So for example, if someone has a pinched nerve because of their posture, forward shoulders, their head is forward, things like that, right? That posture is still putting stress on the neck even after a surgical procedure. And so the surgery may relieve the pain for a period of time, but the root problem is only going to cause the ultimate problem to compound over time, because the root problem, which is the posture, is not really being addressed by the surgery. We're only addressing the symptom of the pain and hoping that it's relieved as we give more space to the neck, or for the nerve to move throughout the neck, versus actually helping the neck's space to be sustained and improved over time. So hopefully you found this video helpful. Check out the link in our description below, where you can find a video where we talk about some exercises to address a pinched nerve, and as well as you can hit the link in the description to talk to a PT first. It's a free conversation where we can give you some guidance and ask you some basic questions to help you get clarity on exactly why your nerve is being pinched and why you're feeling some of the sensations you're feeling, whether it's radiating discomfort or achiness or soreness or sharp or stabbing discomfort in the neck. So hopefully you found this video helpful. If you did, like it and leave a comment in the comments to let us know what was most helpful or eye-opening in this video for you. And you can also share this video with someone who you know who will benefit from it. And make sure that you subscribe to our channel. Hit the bell notification. If you look at that button on under this video, it says subscribe. Hit the subscribe button so you can stay up to date on all the videos we make to help you stay healthy. Praying for you for Mobile. It's Dr. Toby here, and I can't wait to see you in the next video.